The Medicare Advantage market is also attractive to insurers, which also accounts for some of this growth due to the profitability of this market. And as a result, plans have marketed these plans fairly aggressively to increase enrollment in plans. Though I will note that this year some insurers have reported facing headwinds due to higher than expected utilization, but overall, we still see this as a pretty attractive market to insurers.
The insurance industry overall is interested in and attracted to the Medicare Advantage market, both because of growing enrollment and the aging in of the baby boomer population into Medicare in general, which has driven a lot of the growth in the last few years and will continue into 2030.
They may not be aware that they are often subject to prior authorization requirements to receive services, or that they do have to choose from a network of providers and that the doctor that they might want to see might not be in network. Medicare Advantage doesn't have its own separate revenue sources. Medicare pays private insurers a fixed amount per enrollee adjusted for health risk to provide all Medicare Part A and B services. And to get a little bit technical, just to explain a little bit more how the plans are paid, the payment amount to plans is determined through an annual process in which plans submit bids for how much they estimate it will cost to provide all Medicare covered benefits for an average beneficiary. And the bids submitted by each plan are compared to a benchmark. And plans that bid below the benchmark receive a portion of the difference between the bid and the benchmark as a rebate. And I say all this because the rebates are really important because those must be used to reduce cost sharing, subsidize the standard Part B and or Part D premium, or pay for all those supplemental benefits. MedPAC, every year regularly compares average payments to Medicare Advantage plans to what similar beneficiaries in traditional Medicare would spend, and has consistently found that Medicare Advantage payments are higher. And that estimate of $88 billion for 2024 factors in rebates, coding intensity, and favorable selection.
If you look at the raw numbers, I do think Medicare Advantage spending on average has been higher than in Medicare fee-for-service. And that is partly because Medicare Advantage covers a more generous benefit than Medicare fee-for-service. So the government is spending more, but getting more out of its spending for those beneficiaries. The Affordable Care Act tied the star rating of Medicare Advantage plans to the payment system through the quality bonus payment. And since the ACA was passed, we've seen Medicare Advantage plans devote a ton of resources to their performance on the star ratings measures, and so they carry a lot of weight to the plans because of the financial incentive, but also because plans are really committed to their performance and improving their performance over time.
There's been concerns in recent years about aggressive and misleading marketing of Medicare Advantage plans. And in response, CMS has published some major regulations in the last couple of years, mandating stricter oversight of third-party brokers, and also adding new requirements intended to curtail misleading marketing activities. One of the changes was restricting the use of the Medicare part of card or logo in a way that would be misleading. And that's important because people, would think that, some commercial that they're seeing or some documentation was, officially sponsored by the government, when in reality, they might be sponsored by a broker or by an insurer and not coming directly from the government. And that was confusing to a lot of people. CMS is also now generally requiring plan to submit television ads ahead of time before they're aired. And that's also intended to ensure that advertisements aren't misleading. We did an analysis and 85% of the ads included were for Medicare Advantage plans, and few, if any, had mentioned the traditional Medicare program.
And I don't think anybody wins when a Medicare beneficiary is convinced to sign up for a plan where their drug's not on the formulary, their doctor's not in the network, they have a really high out-of-pocket cap they don't understand, or their dental benefit that they think is going to be generous enough is not generous enough for what they really need. So it's in our best interest and in the industry's best interest for beneficiaries to understand the product that they're signing up for, and that they make the decision that's best for them. Prior authorization is a utilization management tool that health insurance plans employ to first determine that a particular item or service is medically necessary for a given beneficiary. So a provider, a physician or other hospital before they provide or deliver a particular service may have to request that the Medicare Advantage plan review the service and the medical history or the relevant clinical details for a given beneficiary to determine that they meet the threshold or standard for providing that service. So the first part is to make sure that that is medically necessary. In traditional fee-for-service, that doesn't happen as prior auth on the front end. What it looks like more often is that the Medicare administrative contractors who are responsible for paying provider claims will deny a provider claim on the back end for not being medically necessary. Part of the reason that tool exists also is because in a fee-for-service environment, there may not be fully aligned incentives between providers who are generating revenue by delivering the services and the health insurance plan who's covering the cost of those services.
KFF, has done some work on this, and our data show that virtually, all Medicare Advantage enrollees, or over 99%, are in plans that require prior authorization for some services. And another analysis showed that over 35 million prior authorization requests were submitted to Medicare Advantage in 2021. Optimally, prior authorization deters patients from getting care that's not truly medically necessary, which reduces costs, for both insurers and enrollees. It can also create, hurdles and hassles for beneficiaries and their physicians that may limit access to care. So, prior authorization can lead, to delays in getting care, and also, just adds to provider burden, particularly if, different insurers that they work with require sort of different documentation. We still don't have information about, prior authorization denials by type of service, for example. We only have, information on aggregate denials or information at the plan level. Currently, we only have information at the contract level. And what that means is that we're just, not able to assess things like whether, certain services are denied more frequently than others, or whether certain plans tend to deny services more often than others. And that is information, that could be useful to people, particularly if they have like a service that they tend to need prior authorization for, say like every 3 months, to know, whether a plan has, tends to require prior authorization, might be informative when they're selecting their plan. Another area that we've talked about in terms of data gaps is the use of supplemental benefits. CMS has recently made some changes to require plans to include data about use of supplemental benefits that should be available, I believe, starting in 2025. But currently, we don't have data about how often they're used, how much people are spending out of pocket, whether there's differences by use in certain areas. And we're also just not able to assess whether the use of these benefits truly has a positive effect on health outcomes or affordability, despite a fair amount of money being allocated to these benefits.
A lot of the payment system in Medicare Advantage right now sort of reflects a number of adjustments that were made to achieve the political consensus necessary to pass the legislation, and those adjustments may not be no longer be appropriate or serving the intended purpose. And so I think some of these different peculiarities will be revisited when Medicare Advantage is looked at more holistically.
Medicare is consistently popular, and people are generally satisfied with their Medicare coverage, both if they're in traditional Medicare and Medicare Advantage.